Sawasdee Krub, and good afternoon, ladies and gentlemen. It's truly a pleasure for me to have the opportunity to share some thoughts with you this afternoon. My name is Abhijit. I'm responsible for ISS country operations, and I have with me on stage Christopher Luscher, who's the Chief Technology Officer of ACT. I'm extremely excited today because we are going to share with you a world-class technological innovation that has the potential to create real positive impacts in the healthcare environment, that has the potential impact of transforming our cleaning environments into truly hygienic environments by reducing and eliminating bacteria and unwanted microbiology. So we will be discussing a little bit about these benefits in a short while. But in the first 10 minutes, I'd like to spend some time talking about ISS and what we do. And also we have some examples of what we are doing around the world. So we are a people outsourcing facility management company. And it is our job to make the role of our customers, that is healthcare providers, to make it easy for them to focus on their core business, which is patient care and patient recovery and all of those objectives. And how do we do that? We do that by designing facility management solutions, and these are solutions that are fully integrated. And so today I would share with you in a short while a short video clip of about 4 minutes, which will give you an idea of what an integrated facility management solution could potentially look like. But before we do that, it is important to understand what the objectives of an integrated facility management solution is. It is intended to give you a positive experience. So if you can just visualize a patient or visitors of the patient visiting a hospital or a healthcare service provider, what you really want to do is that across the entire journey that the patient has from the time that he enters the hospital until the time that he leaves the hospital, that journey should be a journey that gives a lot of positive experiences across all touch points. And that is our intention. Looking at it philosophically, life is all about positive experiences. So when we have experiences that are positive throughout the day, we go back home extremely satisfied. And that's what we try to do here. So if you look at the slide, then starting from the point that the patient arrives at the hospital, where hopefully he's greeted by a security attendant who is an ISS employee, and hopefully that employee will have a smile on his face and will be proactively assisting the patient or the visitor. And then you go on, in some countries, ISS actually runs ambulances. So you have the ambulance, and you have the patient coming out of that ambulance in a wheelchair, which is probably moved by an ISS employee, who is, again, proactively helping the patient. And then you go into the reception area, where you have reception staff who are proactively delivering service with a human touch. And then you go into the hospital, where there is a clean environment, again, hopefully cleaned by an ISS employee who is fully aware of the importance of cleanliness and hygiene in healthcare. And finally, the journey ends at the same door that the patient or the visitor entered, with, again, the security attendant almost sharing the relief and the satisfaction at you being able to go back home. So if you can imagine this whole journey, it's a question of delivering a facility management solution that is oriented towards delivering service with a human touch, so that a hospital is able to really demonstrate that you actually care for patients. So let's have a quick look, a 4-minute video, which gives you 2 examples, one in ISS in Singapore, and the second is ISS in the UK. And you will have an idea, hopefully, from the video of what an integrated facility solution means.
Understanding the complexities of how medical treatment is provided is fundamental in servicing the healthcare sector throughout the world. Demographic, political, economic, and environmental changes are just some of the reasons for the growing treatment requirements and cost pressures facing the healthcare industry today. Servicing the healthcare sector involves far more than preventing cross-contamination and maintaining a lean and effective operational setup. It also requires a certain amount of patient care and the ability to interact with vulnerable people and busy hospital staff. ISS Healthcare specializes in balancing quality and cost to best support healthcare professionals in delivering operational excellence and a positive patient experience, in addition to their everyday medical treatment centered around the patient's needs. Singapore is recognized internationally for its world-class healthcare sector, and one of its flagship medical establishments is the Singapore General Hospital, where ISS provides cleaning, pest control, portering, and porch services. In 2010, the relationship was expanded to also include facility management, including mechanical and electrical, and energy management. At the National University Hospital, ISS Singapore has introduced an integrated bed management system called eHIMS. It stands for Electronic Housekeepers Intelligence Management System, and it has led to more than a 50% increase in efficiency in preparing hospital beds between patients.
Innovations like the mopping system, innovations like the eHIMS or the bed management system, are all these practices that we acquire from the ISS network.
Close association with the healthcare sector in Singapore started about 10 years ago when ISS Singapore developed a strong working relationship with ISS UK. The focus was on the sharing of best practices.
This ability to acquire best practices from the ISS network, coupled with our ability to customize our local knowledge, the people we have as a combination, is a powerful tool.
In the world of healthcare, ISS supplies all of its service lines: facility management, catering, security, cleaning, support, and property services. In the UK, ISS still leads the field of healthcare services. Public-private partnerships, the so-called PPP-PFI initiative, has provided an interesting development opportunity for ISS.
The Private Finance Initiative is all about essentially designing, funding, building, and then operating, and then leasing back an infrastructure. In our case, it was hospitals, of course, leasing it back to the health authority or the NHS trust as it is. And we are now probably the largest provider of facility services within the PFI. We are developing a process for assessing individual patients as they come in, working with nursing staff. I think that's very important to emphasise, so that we can really help our clients to deliver the outcomes that they are responsible for, which of course in healthcare is making patients better.
Today, the healthcare sector constitutes more than 10% of ISS revenue, and it is one of the most important markets for the group. In order to drive the international development of healthcare services, a Centre of Excellence has been established at corporate level, with the purpose of better understanding the needs of patients and how ISS can further support the work carried out by medical professionals. After all, the aim of ISS is to help healthcare organizations to become better at what they do, which is to treat and cure patients. ISS, a world of service.
Right, so hopefully that would give you a bit of an idea of what an integrated facility management solution could look like. We have a number of countries where we're actually operating these solutions, and over the course of this seminar or even later on, we would be more than happy to provide further details and have discussions, because we are really, really committed towards delivering such solutions. So some of the quick details about ISS before I wrap up. We are present in over 50 countries worldwide with about 500,000 employees. Here in Thailand itself, we have about 35,000 employees. We care very much about values because we're a people company, and therefore the solution will really be a merger, a meeting between technology and people. So on the one hand, we talk about technology, but on the other hand, solutions are delivered by people. And therefore, those people have to have values, have to have strong principles, and we continuously focus on that. And here in Thailand, as we said, we have about 34,000 employees, over 2,000 B2B customers, and we've been in Thailand for over 32 years with a pretty strong footprint within the healthcare segment. So as you can see on the slide, we have right now within the private healthcare segment, we are happy to be serving about 25 customers with about 1,500 employees in these 25 customers in various hospitals all over Thailand. And these are the final two slides that I wrap up. So we're extremely happy today to be talking about this partnership between ISS and ACT. ACT have pioneered a world-class technological solution which is aimed at making a tremendous potential impact in terms of reducing bacteria, in terms of transforming a clean environment into a super hygienic environment. And this solution is something that Christopher very shortly will be talking about. But basically, where it meets, where we meet together on this is that ISS have already, from a service point of view, have a major exposure within the healthcare industry where we provide facility management solutions. And we believe that this technology solution that ACT have come up with, which is aimed at reducing bacteria and doing it in a way that is cost effective, doing it in a way that has very few interruptions in a hospital's operations, doing it in a way that is environmentally friendly. As you can see, all of these benefits is extremely important. So the product that I think we will be, or the solution that we will be focusing on a lot is something called Clean Coat. And it's about the challenge of airborne bacteria. That's the key challenge. And so how do we get rid of airborne bacteria in a hospital, or for that matter in any environment, whether it's a hotel or any other environment? And the Clean Coat solution is a solution where you can do it in a very cost-effective way. You can do it just once in a year, where you actually do a coat. Christopher will talk in detail about the solutions. We have already started doing some pilots here in Thailand, including in a hospital, and we have seen very, very good results in terms of reduction of bacterial count by as much as about 80%, I guess. So, and there are ways, what's very important is there are ways of clearly measuring this bacterial count, and so it can be clearly proven that the environment before we did this treatment and even after 2 or 3 months after we did that treatment has a significant change. So with that, it is a great pleasure for me to welcome Christopher Luger, who's the Chief Technological Officer of ACT, who will talk to you a little bit more about the solution. Christopher.
So thank you for the nice introduction. Yeah, I'm here today to talk to you about what ACT brings to the market here. And our whole philosophy behind the company is to create a low bacterial environment by utilizing state-of-the-art technologies. So first upon, the company was founded by the notion of innovating in hygiene. It started out with traditional cleaning, moving items around for visual disturbance. Then we had the onset of disinfection that showed that one could actually remove microbiology, the dirt we couldn't see. Then we started effectivizing it, using technologies better. And in the future, we will have more technology that will assist the day-to-day operations of maintaining a hygiene environment. So the mantra we are working with is that we want to fight unwanted microbiology, and we want to do it in an effective, eco-friendly, and safe manner. What we offer is a full ensuite of technologies that cater to different specific scenarios. Our flagship product is a clean coat, which is a titanium-based coating that renders all coated surfaces antibacterial or self-disinfecting. What that means is that when a undesired microorganism lands on a treated surface or come close to it, it will be oxidized and broken down. What this means as a result is that your cleaning becomes more effective because you lower the bioburden in between two cleaning cycles. A second effect from that is that any recirculating bacteria coming from air conditioning units or just any residual sources in the environment will slowly be broken down and pulled out. And that alone alleviates much of the problems seen in healthcare today. And of course, as we also mentioned earlier, this can be monitorized using standard benchmarked microbiology surveys. In that way, we can quantify what was the level before and what is it after. By introducing this, we can also add some other key contact points. One could be a long-term hand sanitizing product. It can be an antibacterial bed linens for the smart hospital beds. It could be a universal cleaning product that is produced from salt water, and when you put it into the sewage system again, it recombines into salt water, and thereby alleviating any chemical footprint. So, what is it that we are trying to say here? One thing is that Clean Coat as a product is a coating. We do it once a year. Then whenever there is light on that surface, it will activate the air alongside the surface and thereby making it much easier to maintain. What that will result in is that if traditionally when we look at keeping an environment hygienic is that the more effort we put in cleaning, the more we can obtain. With the Clean Coat, we can bend that development so you can obtain more hygiene or higher hygiene level with a lower risk and a lower effort. And this, of course, gives a lot of benefits. It can save on chemical use, it can save on labor, it can save on hospital-acquired infections, it can reduce or alleviate some of the recovery times you have at hospitals. So, first I'll jump into just a single case study. Kolding is a hospital in Denmark. It is one of the front-runner hospitals there. We had a pilot study done there together with ISS, where we had the objective of investigating what was the bioburden before we did an intervention, and then we coated with a Clean Coat, and then we wanted to evaluate what is the results after. The outline of the project was a 5-week project where we had 2 weeks of baseline and 3 weeks of data collection after the coating. And of course, this was driven fully by ISS. We only surveyed the installation of our product. The findings after the 2-week period was that the ATP, which is a energy molecule for microorganisms, so that's an indirect measure of how effective the cleaning is. Here we saw that on a microbial level, the cleaning efficiency increased with 86%. We also saw that the surface microbiology was almost fully eliminated with a 96% improvement. On top of that, we also saw that close to 70% of the air pollutants were actually digested and alleviated from the room. And the airborne microbiology is one of the primary causes of hospital-acquired infections, and this is something that can really drastically change the infections in recovery, and thereby lower the recovery time and therefore get a more effective throughput of patients. It can also mean that surgery can become less cumbersome because you don't have to handle infections meanwhile. We also had some target organisms that we tested for. Here we tested for Listeria and Salmonella. It was conducted in a maternity hall, where they also had stay rooms for newly made mothers, so they could actually bring in food, and therefore they had an interest to see how much food was actually brought in and what type of infections would be coming directly from the food. And here we saw, after the test period, a 100% reduction of the target organisms. This means that actually before we coated, we did find Listeria and Salmonella in the drains, in the sinks, and on the table counters near to the maternity ward. And after, there was no measurement that could detect any of these. Here we have a peer-reviewed article that was published in the American Journal of Infectious Control, where they have isolated the net effects of having a titania coating in a hospital setting. Here they did an installation, and then they measured over a year what was the drop in infections. So you have the urethral infections, you have the normal chest infections and common fever, and then antibiotic courses. And here we see that across the board, there's a drop between before and after the installation of a clean coat, and the overall average was a 30% reduction in the hospital-acquired infections alone. And this is only if we talk maintaining no improvement to the hygiene design of the building, no improvement of the utilization of different technologies for improving beds or personnel security and so on. So this is only isolated to the clean coat. This we can also expand to other test studies that we have been doing. One is in a private hospital in India, just so we can see that it's not a climate distinct. This is a very small scale test we did. We flew out and we said, okay, can we replicate some of the similar findings that we did in the Danish hospital? And what we see here is, once again, we see a definite improvement in the cleaning efficiency on the microbial level, and we see that the surface microbiology is reduced with almost 70%. This we also tested in another hospital in India. While we were out there, we wanted to take two. That makes more sense, be more effective with the time. And once again, here we see similar numbers, but here we also included some target biology from a request from the client. And once again, we see around 40% reduction in the cleaning, or increase in the cleaning efficiency, and a near 70% reduction in the surface biology. What this means is that we have now demonstrated that in a hospital environment, we can drastically remove the residual bacteria by rendering any surface that we coat with a defense mechanism of anything that just residually circulate around in the environment. That will directly influence how you maintain an environment. If you would compare our coating to traditional measures of removing residual infections, then we are talking fumigation. We are talking doing that whenever there has been an outbreak. So we have to shut down your facility for 1 or 2 days, fumigate it, make sure to ventilate it, and then put it back into operation. And this is something we have to repeat on a monthly or bi-monthly time to ensure a high hygiene level. Here we can do it by doing one fixed installation, and then just by turning on the light, you will have similar results for the full year. So that will save you in your operational downtime. It will increase the effectiveness of the traditional cleaning protocols by improving the hygienic design of an already installed facility. And this is only the beginning. Thank you.